He wanted nothing but the best for all of us, and yet he had to make this choice.
A Calgary couple is pointing to gaps in Alberta's mental health support system. Their 50-year-old son took his own life just days after a phone call consultation with Alberta Health Services. He was expecting to speak with a psychologist.
I can only imagine how disappointed and he felt.
Bob and Peggy Gibennus say their 50-year-old son Ken had been living with mental health challenges for years. In early January, Ken's psychiatrist recommended psychotherapy and arranged a consultation with AHS for January 14th. It was then that an appointment with a psychologist was made, but it wasn't coming anytime soon.
He couldn't get help. Not till April 28th. 3 months, he'd have to wait in this dilemma. He'd already been, since August, struggling.
He couldn't wait 3 months. He waited a week, and he lost the battle.
Ken died January 21st, just 7 days after his consultation. Though the couple is understanding of backlogs and increased wait times, they wish there was a better way to get help for those who need it now.
This man was very, very ill, and I feel like he ought to have been a really good candidate to be moved to the top of the list.
Following Ken's death, Bob and Peggy reached out to AHS, hoping to see a grief counselor, but further delays pushed them to pursue alternative options.
When we found out that it was going to be 9 months before we could receive some grief support from AHS, we contacted Canada Mental Health.
3 days later, Bob and Peggy attended an online therapy session organized by the Canadian Mental Health Association. City News reached out to Alberta's Ministry of Mental Health and Addiction for comment. They directed us to AHS, which in a statement said, "Demand has increased across the healthcare system following the pandemic, and that includes addiction and mental health services. We know now more than ever Albertans may need additional support, and AHS is focused on enhancing service delivery and system coordination." AHS thoughts are with the individual's loved ones.
He's just such a beautiful man that we lose at 50. He didn't get to experience being a grandpa, walk his daughter down the aisle.
AHS says those struggling with grief or depression can seek support through the mental health hotline at 1-877-303-2642 or reach out online. In Calgary, Tate Laycraft, City News.